Hi, I am Khushbu Gandhi and I am going to present Capstone Project 1 and Capstone Project 2 through this PowerPoint presentation. My topic is waiting time in emergency procedure and services in Canada. Nowadays, it increasing. In some priority procedure and in some emergency situation when Canadian really wants to immediate care, they have to wait for a long time. They have to wait for some priority procedures like some surgeries and diagnostic procedure and like CT scan and MRI and ultrasonography. I got some data from Kai High for the year 2019, 2020, and 2021. As I said about some surgeries like hip replacement, knee replacement, and cataract surgery, we can see the difference of a pre-pandemic and after pandemic. Here you can see that the diagnostic procedures data which I have collected from the Kai High, we can see the difference between pre-pandemic and after pandemic. So COVID-19 pandemic also made huge difference in that waiting time period. So here I would like to present some possible work plans in which first I want to say that a gradual increase in the budget of the hospital can make huge difference. By increasing machineries and some surgical tools, we can increase the hospital outcomes and ultimately it decrease the waiting hours for the surgical procedure and diagnostic procedure also. So my second plan could be the community side. By increasing the focus on the community's health, we can ultimately increase their health status by giving health education, by arranging webinars, seminar, and all. It will increase the ratio of surgeries. It will decrease the ratio of surgeries and also disease, and we can decrease the waiting time hours. Yes, this is long-term procedure, but still we can use that. Thirdly, hospital or organization can make some local innovations like making stroke unit, cardiac unit, and also bifurcate the emergency department by less or more emergency situation. By that, we can decrease the long hours wait. But in that one error could be there as hospital has to spend more on resources and they have to train the staff for particular unit. But yes, I can say that it is very good and effective work plan. Next could be hire more staff to the organization, which could be increase the outcomes of the hospital and decrease the long waiting hours for the emergency treatment. The collective system design technique for improving emergency room work, in which the special staff of emergency room will find out the gaps and then they will find out the possible solution. By this method, we can increase the effectiveness of the work in emergency department and decrease the long waiting time. My next work plan is to work on telehealth. Nowadays, by the use of technology, we can do virtual consultation by registered nurse or doctor, and by that way, you we can decrease the long waiting hours in emergency room. Of course, we cannot do it for all situation, but yes, for some minor problem, we can use that. So this is also very effective method. Here is my references. Thank you so much for hearing me. Thank you.